Hi guys, I'm going to be talking today about my clinical experience. I was in orthopedic setting at Spine and Sport in Imperial Beach. So I'm going to be answering a couple questions and yeah, here we go. So, what do you find helpful during your preparation for your first clinical experience? Based on the name Spine and Sport, so I knew that I was going to be working with spine patients. So I went over all my protocols for ortho, um, exercises. So mainly going over extension bias, which is the McKenzie approach, and then going over Williams approach as well for flexion. Those were the main things, exercises, and then my CI was mentioning going over rotator cuff, so I went over that as well along with exercises. I went over joint mobilizations, but my CI mentioned based on patients being chronic, we were not really going to use it. It was mainly focusing on exercises. So I drill into that. That was really nice to go over it. It was kind of fresh because we were just having ortho in the summer and then we were doing labs right now. And another main thing was I was talking with some of my classmates and then I came across Aiza work at another location for Spine and Sport. So she gave me a lot of little tips about the type of machines they use, MedX, which is specifically just to, I was mentioning in one of the discussions, and it's just for spine patients, trying to like lock every other muscle that you can use and focusing on your spine. So that was really nice to not be in a complete shock, like, whoa, I don't know the type of machines or how they're using the type of approach. So that was really, really helpful. Thank you, Aiza. Um, and then just yeah, protocols, exercises. Those were my two big things. So, second question is, what would you recommend to a classmate who will be completing their first clinical experience in a similar setting to prepare, for their clinical rotation? I would say be familiar with protocols. For most of my patients, they were chronic, so we were looking into the protocols, but not as specific because they were already like 2 3 months along, so it was not something new, but it was still really important for us to know that type of thing. And then being in an ortho setting, just be mindful that you're going to be working at a fast pace. It's not something that, oh, I'm just going to see like a patient, I'm going to be going over like a hospital. I feel it's really hard as well, but you have maybe more time. I haven't been there, but based on stories that my classmates have mentioned, with this one, it's like half an hour, half an hour, half an hour. You have another patient. So it was challenging. Um, I was tired after I finished, but it was really nice because we had a little bit of downtime and then we'll go over documentation. So every single aspect we will use it for something else. So preparing, it's be able to do fast with your notes, be able to multitask, time management. That is something that not a lot of people can have it right away. It takes some time, but with our experience right now, we only had 3 weeks. We had to go into and be fast because there was no time. So I guess it was good. I feel those 3 weeks helped me a lot to be fast, but I definitely needed more time to be able to grasp more information. So another question is, discuss specific challenges you experience and what strategies you implement, and did it help with those challenges? Um, Mainly my thing was I was jumping between my CI, another PTA, another PT, because sometimes they weren't there because they were not scheduled to work on Mondays and I was going Mondays, so I had to work with the PT. I got the opportunity to see his notes, how he worked. Then with another PTA, she gave me a lot. She had like over 40 years of experience. So that was really nice to be able to see different types of techniques, skills, even exercises or documentation was a big thing. So just because I was exposed to different type of styles in such a short period of time, it was challenging because I would do my notes and I wanted to do it how my CI wanted it, but then I was grabbing a little bit of pieces from the PT, from the PTA, try to like implement into my own, but at the same time working with what my CI wanted, because we want them to see how we're able to kind of like mold our different types into one. So, and then time management was a huge thing, especially because you don't know the patients. I feel at my third week, I was able to, oh, I already know this patient. I know what exercises they have. So it was easier for me to be able to, okay, I know this. He can do this, this, and this, and this. 3 exercises, I will go with someone else. So I think just knowing the patient, that helped a lot as well. Another question is, discuss expectations of your CI and facility, such as time management, documentation, patient safety interventions, discharge planning, and anything else you think is important. So I was mentioning my CI knew like main thing he wanted is documentation, be able for me to be fast, which I was able to do in the short period of time. My CI was really nice, and then he didn't push me a lot in a way that he wasn't right there with me. He would leave me space for myself to, okay, what can I do? He will ask me questions, know that I was doing the right thing, it was not going completely off, and he will be like, okay, that's fine, and then he will let me be. He will come back and, hey, do you have any questions? No, I'm good. So every time I was trying to do something, an exercise, and just if I wasn't sure, I will go back to him. It's like, hey, is this right? It's like, yes. So he made me feel so comfortable. Like I know my stuff. I am prepared, and everything that I was saying or trying to implement into their plan of care was right. So that was really nice. And I think everything, it was like just time management is just like the main key, because you're looking at like 14, 15 patients a day. It is hard, it is sometimes stressful. Um, but it was really nice to be able to work with patients, give them their education, which in the area in Imperial Beach, it was mainly Mexican community. So be able to explain everything, all their like insecurities or like not insecurities, their questions. I was able to answer them and provide an education for them to follow up with exercises or posture or little tips that will help with their care. Another question was, what do you like about your setting, and could you see yourself working with this patient population? So definitely I would like to work at an outpatient, especially with the geriatric population. I really like them. I really like working with them. And then I saw how education was kind of like gold mine, like how you give them a piece of information that for us can be really simple and for them can create a big change, a change for them to become better, to improve in their care. So I really like the setting. I really like that I didn't have any time off. So my time at the clinic was like fast. You couldn't like, oh, it's already like time for lunch. Oh, it's already time for me to leave. So I really like that. Um, it was challenging with the pandemic because you're so, I am like, I want to be hands on. You want to like do a lot of stuff that sometimes it gets restricted because of pandemic, but we made, I say we because me myself and then the staff was like really nice, even though we're facing a hard time right now. Spine and Sport, they're pretty good, and I would recommend it. All the staff was really nice, and the clinic was pretty good. So hopefully you go and just visit. It's not something that you're like an injury, but a great team. Thank you guys for listening. Have a nice day.